Good afternoon, everyone. Thank you for joining me today. I am pleased to advise the public that this year the government will not be increasing the public's standard health insurance premiums or the premiums for HIP or future care. The standard premium rate, or the SPR, is the premium for the mandated basic health insurance package in Bermuda. And by law, every insurance policy has to include this in their package, and its price is regulated. So again, we will not be increasing the public's standard health insurance premium this year. This standard premium pays for the standard health benefit, or SHB. This covers care at the hospital and some essential community-based services like x-rays, mammographies, and home infusions. The package costs $355.31 per month. It is the mandated portion of the health insurance premiums, and this price, again, is not changing in 2019. As part of the measures that made this possible, we are challenging and changing the way that we pay for the island's only hospital so that they can focus more on health care and less on generating claims, billings, and so on. So the money in the standard premium that is intended to pay for the care in the hospital will be protected exclusively for that purpose. However, allow me to provide some context. As we are all aware, Bermuda's healthcare system is unsustainable. We are the third most expensive health system in the developed world, and our outcomes, measured by life expectancy, are not amongst the best. In fact, we are below average. And it is clear that we are not spending our health care dollars wisely. Indeed, over the past decade, Bermuda has been actively concerned about the pace of the increase in health care costs. The Bermuda Health Council's National Health Accounts reports that in 2017, as a country, we spent $723 million, and this is over $11,000 per person and 11.5% of our GDP. But despite the level of spend and what feels like relentless increases year over year, a lot of work has been done that has successfully averted a much worse case scenario. In fact, Bermuda has bent the healthcare cost curve. In 2010, the National Health Accounts report predicted that if growth continued at its current pace, by 2017, our total health spending would have reached $1 billion. And this is a staggering figure for 64,000 people in 21 square miles. However, we were able to bend the cost curve, and since 2011, we have sustained total health spending closer to the $700 million mark. And this did not happen by accident. A lot of work has been done to put downward pressure on the forces that push healthcare costs up, forces such as our rate of illness, service use patterns, our aging population, and the price of services. The Ministry of Health is wholly focused on and committed to containing healthcare costs and improving access for all, affordability, and patient outcomes. These priorities are the foundation of our upcoming reforms. In this year's throne speech, the government committed to reforming the way that we pay for healthcare. That work is progressing, and soon we will be in a position to have more dialogue on what this will look like. But in the meantime, the work to maintain downward pressure on our healthcare costs must continue. Unfortunately for us, we are swimming against the tide. Our population is very unhealthy, and as we are aging as well, and our health complications deepen, and that increases our costs and makes them skyrocket. Lifestyle preventable conditions like hypertension and type 2 diabetes cause the population to need more and more health care. And with that, utilization of our hospital grows as more people's care has to be paid for. Diseases like diabetes and kidney disease have an estimated cost to our country of nearly $78 million per year. And as I said before, that is staggering. Just 2 preventable conditions consume more than 10% of our total healthcare spending. The cost to the system and to the hospital and to our premiums is untenable. Such pressures result in higher health costs. So in addition to addressing chronic diseases, we also have to reconsider how we pay for health care. It has been long established that the fee-for-service or volume-based payment models are very costly. While they work well to incentivize some behaviors, They also inhibit a focus on good health outcomes and accessibility of services. The Bermuda Hospitals Board is the largest part of our health system. It provides the most complex care to the largest number of people, 24 hours a day, 365 days a year, without rest or respite from hurricanes and holidays. And it is a vital